Hi, this is Dr. Kate Eckard, and today I'm going to go over some reasons for neck pain that you might not have thought of. So if you're having neck pain and you can't figure out what the reason would be, something that I see a lot in my office is neck pain that's presenting in the back of the neck, feeling like tightness, stiffness, pain, lack of range of motion, those kind of things. People just don't know where it's coming from. They might have stress, those kind of things, and that often is tied in with it. But one hidden cause that people don't think of are having Invisalign. So Invisalign or wearing a mouth guard at night can sometimes cause you to clench down on that guard. So what happens? Why would that give you neck pain? Just clenching the teeth. Well, as we clench the teeth, we get tightness in through the masseter. So that's the muscle in the jaw on the side of the face that's partially involved in chewing or clenching. And then we also have the temporalis, which is up on the sides of the head, that's involved with clenching. We find those a ton with our headache patients, trigger points and little knots in through there. So if you're rubbing on the sides of your head and you feel little bumps or sore spots, that's your temporalis. You might have some issue there. The other thing that happens with clenching is our SCM gets tight. So our SCM is a longer muscle that goes from behind the ear down the neck and then attaches on to the collarbone and the sternum. So SCM is for sternum, clavicle, and mastoid process, which is on the skull. So there's one on either side. They get very tight when we clench a lot. They also get very tight when we are at a computer and our head is kind of shifted forward, kind of the head out type of a look. So if you're at a computer, we're looking forward at it. Our head drifts forward. If you're contracting both SCMs on either side, those shorten, it brings your head forward. Then when you try to go through normal daily life and you try to bring your head back, it's harder to do. You will get some pain from the compression in the back of the neck. So while you feel the issue in the back of the neck, you're having an issue in the front of the neck. You'll also get tightness in the scalenes in the front of the neck as well. So most people don't come in saying, I have pain in the front of my neck, but they'll have that lack of range of motion and the pain in the back of the neck. Often, even if people are coming in for a chiropractic appointment, I will do shockwave at least once. Even if they don't want to use that as their therapy, I'll use it more as a diagnostic. So I'm looking to see where actually is the issue. Shockwave is unique in that healthy tissue, you do not feel the sound waves going through it. Now that's with focus shockwave, not radial. You won't feel the sound waves through healthy tissue, and then when it hits an area of calcification, it's going to feel like a distinct ache, and that tells me that's where your issue is, and then we would treat that spot. So if you, for instance, come in with headaches, you're not sure the cause, we would do those classic points that we do for headaches, and if you don't have any achy spots in those, we know that your headache is coming from somewhere else, and you wouldn't be a great candidate for that treatment. Same for the neck pain. We will check your suboccipitals, paraspinals in your neck, your traps. We'll check around the ear. We'll check in the front of the neck. We're looking to see what is actually the issue. Do you really just have pain in your neck from trap trigger points, or are you under a lot of stress and having a lot of tension in the front of your neck? So I just had a family member in this week with a stressful job, doing a lot of traveling, having neck pain, and I noticed that they were had Invisalign in, and we ended up finding all those spots from clenching, even though that's not where their pain was. So the pain is not where the problem is all the time. Often it's not where the problem is. So you have to be a detective, figure out what the root of something is. It's just very important in chasing down the entirety of the pain and getting to the root of it. Another thing is, as we always try to tie in, is that if you are clenching, if you just got braces or Invisalign and you are clenching on your trays, you might develop that neck pain, but you also might develop a pelvic floor dysfunction, because when we clench our jaw, we're clenching our pelvic floor at the same time, and that can show up as pelvic floor issues like leakage, urinary incontinence, those kind of things, but it also shows up as hip pain and low back pain and those kind of things. So another sneaky culprit of low back pain and hip pain is pelvic floor dysfunction, and it's often tied to stress and clenching in both the pelvic floor and the jaw. So if you want to fix one, you need to address both, and that's really how we get full resolution of both things. So if you're having neck pain with no known cause, you haven't had a fall or an accident or anything like that, haven't strained it in any way, you've had imaging, you just really can't find the root of it, I would check the front. I would check that clenching. I would try to notice throughout the day if you're clenching your teeth, or ask your dentist if you might be grinding your teeth at night. They might notice some wear on the teeth like that. Or if you're wearing a night guard, that would be another good indication that those would be some spots that we would want to check and then treat. And I usually recommend treating the TMJ area with shockwave, 100%. And then we always combine that with laser, and we laser the temporalis on the sides of the head, because that helps to reduce the inflammation from the clenching as well. And then you really want to get to the root of why you're clenching. If you're not using, Invisalign, you're just getting through that period of how long you have to wear them. If you're clenching for another reason, like it's stress, we want to work on some stress mitigation. So if you've solved the problem of not clenching during the day, next step is to do some exercises before bed to reduce the need to clench, and then work on some nervous system regulation that will help decrease your stress load enough so that you don't feel the need to spiral and clench during the night. So it is a very extensive, well-rounded approach to addressing a problem and making sure we keep it away for as long as possible. We have lots of patients that do not come back to see us for quite a while until they have something new pop up. We just met a woman that we haven't seen in about 2 years, and she'd been doing great with her shoulder pain after having shockwave on it, and has now returned after having to move her house and put a lot of strain on that area. So our goal is to give you that long-term lasting relief, and we find that a really well-rounded approach is the best way to do that.